Right.
Awesome. All right. Well, welcome everyone to fourth trimester Arizona East Valley Village. My name is Jennifer Hoprich, and I'm the facilitator of this circle. We meet once a month, the third Thursday of every month, excuse me, from 10 to 11:30 a.m. And every time that we get together, we have a new topic, different speakers, but it's always an opportunity for people who are in their fourth trimester or those who serve those people to come together and explore and learn from one another and to develop community and support. So I'm just going to share just a little bit about fourth trimester Arizona. So, fourth trimester Arizona was established to honor and support parents as they navigate the very real challenges and joys of parenthood and to connect them with a community that embraces and supports them in parenting. We are the village into which Arizona families are born, and we aim to change the culture of parenting in our community so no one has to do this alone. In our village, families are loved, they are seen as capable, and they belong. This is our time to be there for Arizona families. So thank you so much for joining us in this today. And as I said earlier, everyone is welcome. If you would like to join onto the Zoom with us, you can still do that. And you just go onto the Facebook event for this. There's a link. You can register and you can join in real time if you're watching this live to be able to connect more with the speakers for today. So I'm so excited about the topic we have for today. And you might be wondering, like, what does this mean? Like, the title for our get together for our village this month is "Are You Still an Expert at 3 a.m.?" And the impetus behind this, like, what caused us to want to do this is that um, some of us who are experts in the field were talking about how, we also struggle and no one is perfect. No one knows everything. And like I have pediatrician friends who have been baffled by their own baby's symptoms, and I'm a home birth midwife and I have been baffled during my own labor about what the heck to do next. Um, and so we wanted to gather together some true professionals in their field. They are legitimate professionals in different areas who serve people who are in the fourth trimester. But we wanted to get them together and we asked them to be courageous and vulnerable in sharing with us about their own fourth trimester experiences. We want to get the dirt on, like, were you an expert still at 3 a.m. or were you calling some people or how did this go down? And so we're going to do that. We're going to have some like mama circle time where each of them will share a little bit about their experiences and also how those experiences have informed their career as professionals in these fields. So while they're sharing, I invite you to look for yourself if you see any of your own experiences in their shares. It can be so validating to hear other people talk about their personal experiences with this um, because we're not alone in having those struggles and those triumphs as well. Um, and also, if you have questions for them, like we have these experts here for us real time. Fourth Trimester is a nonprofit, so this whole thing is free. So you've got them here. Let's ask them some questions. If you have any questions that are specific to your own experience right now, or maybe you're going to be giving birth soon, or whatever that might be, if you're on live with us on Zoom, you can type it into the chat and we'll make sure to get to all of those. If you are watching on Facebook, you can type into the comments there and we may be able to view them before the end of it. If not, I'll make sure to get your questions over to them afterwards. So without further ado, I would like to introduce our panel speakers for this time. And so I have there's a little bio I'm going to read for each of them. So I'm going to start with Emily Ruth. Emily, would you wave so we can see you? Hopefully we can see you. So Emily Ruth has facilitated groups in therapeutic spaces as a coach since 2013. She returned to school focusing on an MA in marriage and family therapy with an emphasis in grief and trauma. She has her bachelor's in marriage and family science. She's also completed lots of trainings and certifications in the field. While she deeply values the formal education she's pursued, she feels many of her most important lessons have come through living life. Um, so thanks for sharing some of that with us today. Emily's own pregnancy and child losses and connecting with others who have experienced the same has taught her so much about how to engage as a clinician. Emily deeply honors the innate wisdom of grieving families who are working through the trauma of losing an infant. So thank you so much, Emily, for being on today. I so appreciate you being here.
Yeah, thank you for having me.
Yeah, absolutely. Okay, and then I'm going to move on to Dr. Jenny Beaver. Oh, okay. I just love you so much, Jenny. Jenny was born and raised in Arizona and graduated with a degree in biochemistry from ASU, followed by a doctorate in biology at the University of California, San Diego. Jenny's first child was born while she was still in graduate school, and the challenges she experienced during that time propelled her to become an IBCLC and International Board Certified Lactation Consultant and start a clinical lactation practice, the Arizona Breastfeeding Center. After a rough transition to parenthood with her third baby, Jenny realized the need both in herself and her patients for more awareness and community support around the first months and years postpartum. And so she founded Fourth Trimester Arizona to support the mental, emotional, and physical health and well-being of new parents. She and her husband have 4 children, a noisy bird, I can attest to that, and a quiet dog, and live in Chandler, Arizona. In her free time, she enjoys biking, gardening, and reading. So welcome, Jenny. Thank you so much for being here on our expert panel today.
Thank you.
And then I'd like to talk about Dr. Jessica Kaffer. So Jessica, if you want to just wave, Dr. Kaffer. Okay, so Dr. Kaffer is a licensed clinical psychologist and a perinatal mental health specialist located in the Phoenix area. She provides virtual psychotherapy sessions across multiple states as a certified PSY PACT provider. She graduated with her doctorate degree in psychology from Midwestern University and has experience treating various mental health disorders. Initially, she sought out specialty training specific to trauma treatment and focused a lot of her time on providing services to first responders and members of the armed forces. Although Dr. Kaffer still provides treatment to public service members as well as the general population, her passion for maternal mental health was ignited after she became a mother. Dr. Kaffer felt a special connection to the perinatal mental health population after she experienced her own struggles in pregnancy and postpartum. And after noticing the general lack of resources and education, not only related to mental health, but also to other pregnancy and postpartum needs, she decided to refocus her love and attention on providing support and treatment to moms in every stage of motherhood. It's her hope that through education and appropriate treatment, a community of happy and well-supported mothers will be born. May it be so. So thank you so much, Dr. Kaffer, for being on here today.
Thank you.
So appreciate you. And then we have Holly Lozano, who is a NICU nurse. Holly has been a nurse for 26 years, with a majority of those years spent as a NICU nurse. She works as a developmental specialist at Banner Thunderbird Medical Center. So Holly, thank you so much for being on here with us today. So
Thank you for
appreciate
having
you.
me.
And I want to welcome Marbella also onto the call. Thanks for being here. Okay, fantastic. So we're going to allow some time. So if you can imagine right now, almost like we are sitting in a great big room together in a circle, and we're going to be hearing our panelists share about their personal experiences. We'll just kind of go down the line. And my invitation to the panelists is to share, something that was really challenging for you and just a little bit of letting us into your lives. Were you already an expert in your field while you were going through this, or did this kind of encourage you to research more, and did this contribute to your practice and how you serve? So I'd love to hear you share about some of those things. And then for those of us who are listening, I invite you to look at how this might be a reflection of your own life or your own experiences, how you can see your own journeys struggles and triumphs in what each of these providers is sharing. And then also type in to the chat here any questions that are coming up for you. I want to make sure that those questions don't get lost. So type them right into the chat, and I promise that I will read all of your questions. You can ask questions that are specific to a particular panelist or ones that you would like to have each of the panelists have a say into. Okay, so does that all sound good? Everybody feel like we know what we're doing? Okay, awesome. This is going to be so great. Okay, fantastic. So we're going to start. There's already some questions coming in. Fantastic. I promise we're going to get to those. So let's go around, and I'd love to just hear each of you share, 5 minutes or so, just a little bit about what you went through, what worked for you, how did this influence your practice? Are you one of us, even though you're an expert? How did this work out for you? So how about Jenny? Do you feel like we could start with you? Can you share a little bit of this?
Sure.
Okay, thank you.
Yeah, absolutely. Yeah, so sorry, my husband's walking through. Give me one sec.
All perfect. We all have children among us, and we're all in our homes, so we can all take the breaks that we need. It's all welcomed here.
If it's not the children, it's the no. Anyway, so yeah, so talk a little bit about my postpartum experience. Is that what you're thinking?
I'd love to hear about, yeah, just your postpartum experience, and then, taking into consideration the field that you're in. You had a lot of training, you had a lot of expertise, and I'd love to hear, did you still experience challenges? And what were they like? If you're willing to share what those challenges might have been and how you resolved them and how this may have impacted your practice now.
Yeah, absolutely. So as you read in my bio, after I had my first child, I had a lot of challenges with breastfeeding and, motherhood in general. And that's what encouraged me to become a lactation consultant. And so I became a lactation consultant. I think I finished when he was maybe 3. And we didn't have another child until he was 5. And by that time I had been practicing as a lactation consultant for a little bit. Thought I knew what I was doing, and had my second baby, and that's my noisy bird. Had my second baby, and I remember, so my first one, I have inverted nipples, and so I had to use a nipple shield and all these challenges that would happen. And so I was like, this baby is gonna latch, this baby is gonna do perfect, and it's all gonna go great. And so I latched him on, and I was like so thrilled that I could actually latch him. And I was like, you're doing awesome. And at like my 3-day postpartum visit with my midwife, she's like, how's breastfeeding going? And I put the baby on, and I'm like, it's going really, really good. Yeah, it's totally fine. Right? I was totally having nipple soreness and in pain. And she's like looking at me, and she's like, is it really going well? Oh yeah, it's totally good. And I'm like, so she was like, okay, well, if you need any help, you let me know. And so, I'd just been so thrilled that he would latch, because I had had babies who wouldn't. And I was like, you did it, that I wasn't even really acknowledging the pain that I was feeling from his latch. And what I actually did was I went home and I pulled out my lactation books, and crying, I sat myself down and I was like, you're giving yourself a lactation consult. And I was like, you are not getting in the right position. You're not doing this. And I was literally crying the entire time, right? Like, it wasn't like my mental brain could actually be functioning at that time. I did better, right? Like, I looked at the book, I remembered what to do. But the funny thing to me is that, like, all the stuff that I knew, it just didn't really translate in those first few days, because I was so focused on just being so excited that he latched. And so I had a baby, I can't even show you. And I was doing this, and I was like, it's just totally fine. He's latching, it's totally great, right? And he's like falling off my breast. When what I tell people is lean back and do all this stuff. And so I literally had to sit myself down. And I remember that vividly. And he went on to breastfeed great. But then my third child was tongue-tied. And I told myself he wasn't tongue-tied for 9 weeks, until I had my colleague come over, and she looks in his mouth and she's like, yeah, he's tongue-tied. And I was like, burst into tears. I knew it, but I didn't want to admit it. So yeah, it's so much harder to be a professional when you have your own baby. Like there's a reason you're not supposed to be your own, whatever it is, because our brains are just not ready for that. Right? We're in the mommy brain side instead of in the professional brain side. And I think that happened over and over and over again with me. It's not like it was any easier because I had all this information. It just meant that if I could convince myself to switch over to that information, I might recognize I needed help.
And even I think some ways, Jenny, it can be that when we have that professional brain, it can kind of like throw us off course
Sure.
sometimes, like we're analyzing it, we're like, oh,
Yeah.
well, it must be this or it must be this. And then when we have someone else who has that objective perspective on it, and maybe is well rested,
Right.
they can
Right.
offer, yeah, something different. Yeah.
Yeah. And I think that there's also an aspect of like, oh, I know how to do this, right? Like you tell yourself, you know how to do this. So you're not going to have those challenges. And then when you do, you're like, wait a minute. How am I having these same challenges? Yeah. It's just really interesting.
Thank you so much for sharing all of that. And I can imagine that having that experience has influenced your practice in many ways. But can you share a little bit about that, like having your own challenges, and how does that show up in your clinical practice when you're supporting families with breastfeeding?
Sure. Um, I think having had my own challenges with each baby, just with breastfeeding, I think I really think about whether or not the interventions that we're talking about are sustainable, right? Because there are some things that you can do with breastfeeding that, babies can get to the breast and they can get milk and things like that. But having had my own experience of how challenging it is to be pumping, to be bottle feeding, to be nursing, and doing all those three at once, having my own challenges with the baby who didn't want to latch, I think, when I'm working with patients in my head, I'm going, okay, like how long is this particular thing sustainable? And if it's not, we got to think about a way to make it so mom and baby and partner, if they're there, can live through whatever this is. And I think that that's something that I wouldn't have really thought about if I didn't have my own challenges. I kind of would have just been like, oh, these are the techniques, this is what you do. But it's just like anything, you can give people different techniques, but if they don't have the support at home to be able to implement it, it's not going to help. So I think that helped a lot. And then I think the recognition of, with my third baby, that I was experiencing my own mental health challenges. I think that also hugely changed my practice as a lactation consultant, right? I started recognizing that a lot of the things that we were seeing as lactation problems were actually probably mental health problems. And so getting moms support for that, whether it was physical support with the postpartum doula, bringing in, partners and family to help her, or really getting her mental health support from someone in our community, that would impact breastfeeding dramatically too. Yeah.
Wow, that's so beautiful. Yeah, it really does take a village. It's even if you're seeing an expert in something that's going on for you, you may need to bring in others to support as well. So that's so awesome that you have those referrals where you can help people to connect and to get the type of support that they need. Because like you said, you can read a lot of stuff in a book, too, but is that going to work in your actual real life with your current circumstance, with the level of support that you have with your physical body and just all of that stuff?
Right.
So
Yeah.
yeah, it sounds like, yeah, what it brought to your practice was this sense of reality, of like needing to take that into account with each person and their unique circumstance.
For
So
sure.
that's
Yeah,
awesome. Thank you so much for sharing, Jenny. I appreciate it.
absolutely.
So if you have any questions for Jenny, type them into the chat. Um, and we'll have some time later for the panelists to answer some questions. Speaking of the mental health piece and just how important that is, I think it might be good to bring in Emily. Emily, are you open to sharing a little bit about your experience, and how this may have, you know, impacted your practice?
Sure. So I started out as a birth doula, And I mean, in kind of in the field, and I'm hearing so many of the pieces, Jenny, that you named, how my practice, even as a doula, changed after I had my first son. Again, just looking at like what's realistic for my client, what's real, getting curious about what their lives actually are looking like. Is this sustainable? I love the pieces that you mentioned around that, because that was really big for me as I entered motherhood, and then I could realize, what was showing up for my clients. And so I had two, my first and my second, and I didn't recognize it at the time that I had like severe postpartum depression. I just didn't know. I just thought this is how it is. Like life is just hard after you have kids. You just have to, just put your head down. And so thankfully, by the time I had my last, I was in the field in a deeper way and could recognize it. So I would say, from the time my oldest is 14 and my youngest is 3. So there was some time in there for me to really get to know myself better and get to know what I needed during pregnancy and in the 4th trimester. And so, which was a good thing, because after my last, some of those challenges, they upped their game. I had breastfeeding issues that I hadn't had with my older 2. My depression was even deeper, I would say. And I dealt with some health issues, like a lot of inflammation and a lot of pain, autoimmune stuff. And I am just so glad that I had the support while I was pregnant. I created kind of a support system for myself. So I was seeing a therapist, I was meeting with, a midwife, and I had a good support system, so that when I had my last son, and these challenges were all like even a greater degree than I had experienced before, in some ways they were easier because I had support, and I knew it was not only okay, but it was actually really necessary for me to reach out for help. So I would say that really changed how I practice back then as a doula, and then now in the mental health field, supporting couples and women as they, navigate some of these really difficult challenges. And the same thing around breastfeeding. Like with my first 2, I didn't have any challenges with breastfeeding. And now that I've experienced that for myself, I have so much more compassion, not only for myself, but for my clients when they're navigating that. I love, Jenny, again, that you named like what's sustainable. I don't think I would have let myself consider a lot of the options that I ended up using with my last son. If, it really changed the lens that I was seeing my experience through. And so, yeah, that's a little bit about me. I don't know what else I could share that would be beneficial, but that's a little bit about my journey. And I love the question, how do you peacefully sleep at night without any worry for your little one? And that's when I just get curious, because if I'm not sleeping peacefully, I get curious about where that question is coming from. What is it that I need? What kind of support do I need around this question? So anyway, I will probably talk about that more, but a curiosity is a really huge piece for the work that I do, helping us get curious about where questions are coming from, or where stress is coming from, or dis-ease, if we're not feeling ease in our emotions, really getting curious about where that's coming from and what support we need has really been a huge game changer. And so I would say, again, for my first 2, I wasn't yet really in the field in the same way. And so I think a lot of things were challenges that maybe wouldn't have been as much of challenges if I had reached out for the support that I needed. And even though some of those struggles were even more intense with my last pregnancy, because I reached out for support, and I didn't shame myself around needing support, around reaching out for help, it was so much easier in many ways, just because I didn't feel so alone, so isolated. Even just communities like this. I joined an online group like this, where I met every other day with women. I mean, they had different topics that they were discussing, but I needed that. It was a lifeline for me. And I don't know if I hadn't had those women to connect with, what that would have looked like for me. I think it would have been even more challenging, which is hard to wrap my brain around. So, yeah.
Wow. Thank you so much for sharing all of that. And yeah, yeah, there's a theme there, with both you and what Jenny shared with reaching out for support and having those connections and just bringing in more people, more
Mhm.
support, more listening ears, more people who can help you to navigate those things. So thanks so much for sharing all of that. If you have a specific question for Emily, feel free to type that into the chat. And how about Jessica? Are you open to sharing a little bit? I know you have your little one, and like we
I'm so
said,
sorry.
we all have little ones. Yeah, a lot of us have little ones around. So if you need to
Totally
step
real
away,
life.
yeah, this is real life. We're like actually in our homes with our families. So just know that that's so welcome. But just with what Emily was talking about with, having these mental health challenges and there's a stigma around reaching out, there sometimes it's difficult to find someone. And so I would love to hear, like how your journey unfolded for you. Did you experience any of those same things? And then how has that influenced your practice too?
Yeah, of course. So I have actually three very different fourth trimester experiences with each of my kiddos. And I think with my first, I wasn't in the perinatal or maternal mental health field at the time. I was treating military and first responders and that sort of thing when I was pregnant. And so then um, after I had my first, I looking back, I probably had some baby blues. And then I also struggled with some breastfeeding issues initially, which definitely exacerbated those baby blues kind of feelings and the hormonal stuff that goes on at that time. But we got over the hump, and it was like smooth sailing ish after that because my first is a little spunky, so she was a little bit more challenging as far as like sleep and colic and stuff goes. But my second was easy breezy. I thought that, oh, my first was just hard because I was new and I didn't know anything. And my second, for whatever reason, it was like the birth was easier, the pregnancy was easier, everything. She slept. It was just like, oh, now I know because I have experience. I was way, way off. And although I was working with military and first responders, after I went through that like baby blues and the breastfeeding issues, my focus started to shift with her. I started kind of seeking out more of that population because even in those moments where it was, something that was time limited, like baby blues, I still felt a lack of support. I still felt as though, I got like a questionnaire at the doctor, and that was as far as it went. And I think that, I wasn't having any like negative thoughts at the time of that, but I could see how moms would be like, well, if I answer this a certain way, I could get my baby taken away or something like that. So I think that I was like, there's definitely a gap here that mental health needs to kind of step up their game with. So anyway, my second was easy breezy. And then I got pregnant with my third. Pregnancy was a little bit more difficult. And then my postpartum was okay until she had acid reflux. She got diagnosed with acid reflux, which I hadn't really dealt with a ton before with my other two. And she had something very interesting called Sandifer syndrome. So if you guys haven't heard of that, it's not necessarily a syndrome. It's basically the baby like contorts a little bit to relieve the pressure that's caused by the acid reflux, and they can look like seizures. And so I went to the doctor kind of freaking out that, oh my gosh, I had videos, I had been Googling, it was definitely kind of like the start of my downward spiral. And by this time I was well versed in maternal mental health. I knew about postpartum depression. But when I was faced with something that was like health related difficult for my baby, I completely spiraled. And I did like about 2 weeks where I was staying up all night, not because my baby was awake, but because I was awake trying to figure out what was wrong with her. Even after we got the diagnosis of acid reflux, let's start by shifting your diet, My pediatrician is great in that she doesn't just throw medication at you. She'll try and get you to do some natural stuff first. But because it's natural first and it's not medication, sometimes the shift takes a little bit longer. And so I was still seeing some of those behaviors. I'm like, I just don't know. Maybe it is seizures. And so then I continued to spiral and continued to spiral. And after like 2 weeks, it was at like 2 weeks of just being tortured by this fear that there was something greater going on and I was missing it. My husband looks at me and was like, "Are you okay?" And it was the first time anybody had asked me if I was okay. And I remember like at first I was like, "I'm fine." And then I like actually sat in that and I was like, you know what? I'm not okay. This is not like normal behavior. It's common, but it's not normal. So really interesting about that is I was well versed in mental health, like maternal mental health or perinatal mental health from like what our DSM tells you. And the DSM is the Diagnostic and Statistical Manual. It's what we use to diagnose and we get like a list of symptoms and that sort of thing. What's really interesting and that a lot of people don't know is the current DSM only has, it's called peripartum depression. That's it. So then you think, well, I didn't feel depressed. And so I was like, well, then it's not that. Because I don't feel depressed. I'm not depressed. I'm fine. I'm not tearful. I'm not crying. I'm showering. I'm doing all the things. And so I was like, I'm not fine. This is not depression. I don't know what this is. And so I feel like that was a definitive catalyst for me to like seek the actual trainings and things that I needed to learn more about it. Like, oh, there can actually be postpartum anxiety, postpartum OCD, postpartum bipolar. Like there's a whole host of other things that can come during the 4th trimester that even professionals and doctors in my field aren't aware of. So after those 2 weeks, I was able to kind of pull myself out of it just by acknowledging, okay, this is what this is. It's not what my textbook says, but this is something that was caused in the 4th trimester. And I reached out to family. And again, it's that like community of support. And I started kind of asking for help and giving up some of that like control. And I set parameters on myself because mine was very like anxiety and hyper focus driven. So like I put myself in Google jail. I was not allowed to go on Google anymore. And honestly, that took away the majority of my anxiety because like Google is a great place for general information, but it's also like it's a black hole where you can get sucked into and draw conclusions that are not accurate. And so anyway, long story short, I was able to kind of pull myself out of it. And, you know, that was really what drove me to focus on moms, pregnancy, postpartum, and beyond. And yeah, I think that's all I've got.
Oh my gosh. Well, thank you so much for diving into all of that. And I so appreciate how you just shared like the steps of how that manifested, and then even just like that simple tip of putting yourself in Google jail and how that was able to alleviate so much of your anxiety. And also about how postpartum mood disorders don't always show up as this, typical depressive situation. It can manifest in so many different ways, rage and anxiety and OCD, all those things. So thank you for sharing all of that. There's a couple things in the chat here. Jenny says, my third had reflux as well, and it was so hard. And Jenny says, I can totally relate to that, Jessica. My husband also looked at me and said, you're not okay. And I yelled at him and told him that I wasn't sad. I was just overwhelmed. Then looked at what I was feeling and decided I did need some help. Yeah, thank you for sharing that too, Jenny. And Emily says, yes, there are many who are high functioning, but inside feel like we are crumbling. So thank you for putting words to all of that and speaking to all of that. Thank you so much. Okay, awesome. Well, let's see. Holly, you are a NICU nurse, And so I'd love to hear, like, what were some of your experiences when you had your babies? Did you know everything, all their physical symptoms? You were just like, oh, I know exactly what this is and what to do. Like, how was this process for you?
So to answer the question, no, I was not an expert at 3 a.m. by any stretch of the means, unfortunately. So I was actually a NICU nurse for 3 years before my first daughter was born. And I did kind of naively in my young age think that I had changed a lot of diapers. I had seen a lot of babies. I had held a lot of babies, comforted a lot of babies, fed a lot of babies. Like I knew what I was going to do. And so my first daughter was born, and she was not like I expected. And I'm able to look back and say, she is who she is, and it was great. But my expectations were that I was going to be this mom who did A, B, and C, and I'm at that time I was a lot more of a planner, and my expectations were such that I thought I had it figured out, which was not the case. And so fast forward then a kind of 4-year gap to my second child. And I thought, okay, this one's going to be this one. I know I've had one. I've given myself, okay, I kind of didn't know what I was doing. Now I'm going to reach out, or now I'm going to have my second one. I know what I'm doing. And again, great kid, had her own personality, sleep cycles, eating, all that, milk allergies, but I still felt like, man, I really need to have this figured out. Like kind of I started then to think, what is wrong with me? And at that time when I was a nurse in the NICU, I think I did have a lot of compassion a lot more compassion after having my own kids for, wow, this is really not what they expect. No one expects their baby to be born premature, sick, whatever it might be. How hard this must be. So I think for sure the compassion was there, but I was kind of realizing there's something about these expectations that we have set up for ourselves. And maybe it's from other people, maybe it's internal, maybe it's a combination of both of how we think we're going to be or how we think our child is going to be. So then fast forward another large gap to the third kid. And the third kid, I don't know, I've heard a lot of stories, and Jessica, I've heard your story. Emily, I've heard your story. Jenny, I've heard your story. There's something about that third kid. And by that time, I thought, I do not know what I'm doing. This kid is so different. She had reflux. She, I mean, just a totally different personality. She slept great. That was her saving grace. She slept so good, but everything else was just a lot more complicated. And at that time, I thought, man, I have got to, and I hate to say it, guys, I was in my late 30s, and I was like, I've got to reach out. Like, I do not know what I'm doing. So it was at that point, by my third kid, that I was able to reach out and start finding resources. We lived in Nevada at the time, and getting some help, getting some support for what I felt like I was going through, in just kind of being not what I expected. But in reaching out, I found amazing grace for my situation, for other people's situation, to realize, unfortunately, we set ourselves up for this. I can do it. I'm going to be a mother. I got this. I don't know where these expectations exactly all come from, but we do it to ourselves. And then in reaching out, we realize, I think this is what I needed with my first two kids. With some support, with some intentional support for me and my journey and what I was going through, whether that was a parent support group, whether that was some professional counseling, whatever that looked like. And at that point in my practice as the nurse, then I started thinking, okay, what is out there for these moms? Because they have nurses and doctors and a medical team to take care of their baby. But what are we providing to these moms? And at that time, in the medical field and in NICU, I think we were starting to do a better job at screening for postpartum depression and realizing that moms who have a baby in the NICU are at higher risk for that. So just even that one simple little fact, I was like, what's out there for these moms who are struggling with their, not only their postpartum journey, but then their baby being in the hospital, which complicated things. And so actually by the time my fourth child was born, I actually wasn't working for a brief period. So that was a totally different postpartum journey for me, because like a fourth trimester, because I knew at that point I couldn't do it. He was my fourth kid. I knew what it felt like to reach out and to have support and to know that I didn't have to do it alone. And even though I was home and theoretically, I really struggled in my mind. I'm home. I should be able to do this all myself because I'm not working. But holy cow, I was working my tail off. But realizing that support was so valuable. And also realizing that these kids have one birth parent, and that's us. And we can reach out and get help for us or help for our kiddos in a lot of other areas, whether it be mental health, physical health, spiritual support, whatever it is. But that they get one birth parent, one mom or one birth parent. And we're the only ones that can do that for that child. So how can we get the support that we need to provide that to our kid, to our baby, to our, older siblings as we have more kids. And so I think it's changed my practice hugely, because that's how I was able to get connected with fourth trimester. That's how I've been able to find a lot of resources, connect with a lot of resources in the state and in the Phoenix area, specifically since I work at an area hospital. And how can we support these birth parents so that they can be that parent to that infant? So it's changed a lot of my perspective and how I practice and how I interact with the moms and dads. So.
Oh, Holly, thank you so much for sharing about each of your babies and each of those postpartum experiences. And yeah, it sounds like, again, that same theme of feeling like we need to do it alone, or, that can really exacerbate problems that we're having, and reaching out is a way to find some solutions for those things. In the
And
chat here, sorry, go ahead.
I was just going to add, if it's okay, my husband, and he said I could share this, but he actually struggled with a depression after we had our baby too. So men can experience it too. So it was even harder because we were both kind of going through it. And so, and he didn't open up about it until later. And so it took him a little longer to get resources, but that, that was important for me to know, wow, we both need more support. And it took a little longer for him to get that support, and that just kind of added to the mix. So anyway, I just wanted to name that.
Absolutely. I agree. My husband also had something going on with when my second was born, and I sent him to therapy when we probably both needed it.
Yeah, because like you were saying, there's this idea that we're going to do this alone. But if we're not going to do it alone, then the only person we could maybe turn to would be our partner. But then they're also, maybe taking care of other children, or they're working, or there's so much for them to balance out too. Like, it's not even just two people that are needed. It's more than that. And oh my gosh, Jenny was saying, it's so funny that we think we can do everything alone. So many of us have no problem. This is so great, Jenny. So many of us have no problem hiring someone to help us with accounting or to fix our plumbing. or whatever. But it's so hard to recognize that needing help for us as parents is normal. So like it really, I think just this conversation today goes a long way in helping to normalize that even the experts, even those who have, lots of training and experience and wisdom and education and resources and all of that, we all still need support. Yeah, and Jessica says, I think the facade of social media definitely contributes to the idea of I have to do this on my own. All these other moms are so put together and doing it on their own, so I guess I should be able to as well. What we don't see is the behind the scenes struggles. Yeah, I think that's so valid too. Yeah, we just have that highlight reel. People are sharing the cute, professional photos of their baby or their family. um, and we don't see, like that the house is a complete mess, and the laundry hasn't been done for days, and the older children are in the same clothes, and that they have been in for 2 days, and that's normal. That's that's to be expected, that's what real life looks like. Oh my gosh.
That one makes me laugh, Jen, because so I have 3 boys, right? And with my first 2, I had all these clothes, right? Like everybody gave me clothes for these kids and all these little onesies and these cute outfits. So before my 3rd was born, I went through this huge, thing of newborn clothing. And I took out anything that wasn't like, those little button up or zip up sleepers that go. And I was like, you don't want to put any onesies over anybody's head. We are not doing that anymore. And he would live in those until he like puked on them or wet through them. And then I would be like, okay, it's time to change you now, but we're good. Like, why do you need to change into a day outfit and a night outfit? Like, you're just sleeping all the time anyway. It was funny how different my expectations were. No more cute.
Amen.
I love it. Yeah, lowering the expectations. Such a great tool for fourth trimester. Emily says, yes, it can feel so hard to reach out for help in postpartum because we feel like we should just know how to do it. Like Holly's saying, that expectation can just add another layer of difficulty. Yeah, where do these expectations come from? Jessica was mentioning there's social media, comparison there. It could be, parents. It could be just society in general, expectations we place on ourselves. Yeah, it's hard. Well, thank you so much for sharing all of that. I want to go to some of the questions. So Vanessa has a question that I would love to pose to any of you, anybody who'd like to share about this. How do you peacefully sleep at night without any worry for your little one? Anyone who wants to chime in, go for it.
I can chime in a little bit there. And it really is going to kind of tag team on what Emily had already stated about it, about just being curious. I think before we can find a solution to that, we need to know like what is facilitating it. What is, I know it's like a worry, but are you having difficulty falling asleep? Are you having difficulty staying asleep? When you are waking up or when you're laying awake, what are those kind of thoughts? Are we having intrusive thoughts? Is it just restlessness? What do those thoughts entail? So like there's a lot more information that you would want to dive into before you can arrive at a conclusion. Oh, new mommy, not here yet. So the worry is more so about the what ifs. And it sounds like there's maybe potentially some what we call future surfing going on, or again, I think there needs to be a little bit more information, but anytime you're spending a lot of time in the future, you're definitely impacting your current. And one of the things that I try to tell my moms that have that problem, which many of them do, it's a very common issue, is when you expend energy on 999 different potential outcomes that are not going to happen, think about what you're doing in that moment. It's really difficult to be grounded and centered and enjoy, your pregnancy when you're constantly future focused on the what ifs.
Yeah. I can share kind of my experience with what the question was. I think, especially with my first baby, I was worried that he wasn't breathing, right? Like I was constantly worried that I needed to check him. And so he had a cradle next to the bed, and I would literally sleep with my hand in the cradle to make sure he was still alive, right? There were probably some times I unintentionally woke him up, or maybe intentionally, because I was worried. So that happened. But by the time I had my second and my third, something that I realized was that, just those hormones in those first few months were making me like hypervigilant anyway, right? And having breast milk that was trying to flow, like all those things, it was waking me up anyway. And one thing that really helped me, and I don't know if it would help others, but I sometimes share this, is that in the morning when my husband would get up to go to work, and I still, I didn't need to get up at that time, I would nurse the baby, and then I would hand him the baby, and I'd be like, go in another room and leave me until it's time for you to leave. And then I would get, a half hour to an hour of uninterrupted sleep when I wasn't on call. Someone else was watching that baby, and I felt like I could really relax. And that made such a difference. It doesn't seem like it would, but I would wake up and be like, oh yeah, I can do today now, versus, if I had spent the whole night on call. So, I mean, that's kind of how we dealt with it. And the older my babies got, the less worried I was. There's a lot of stuff around, just worrying that your baby's going to be okay. And so the older they got, the more I'd be like, okay, look, they survived. And then I think I just started sleeping better. So
I think too, piggybacking on what both of you guys said, is knowing, even if you're just preparing for that baby to come, knowing who your resources are. So having peace of mind that you found a pediatrician that you feel like you can connect with, and ask questions to. Having support from maybe a friend that has a kid, and sometimes that can be not helpful, but sometimes that can be helpful just if you're like, man, I'm tired. And for just to hear, yeah, it is tiring, it's exhausting. So, and sometimes just kind of knowing some other resources so that those fears and anxieties that we anticipate might happen, if they do happen, that we kind of know where to turn. Like, where are some places that we feel are trusted sources of information and valuable knowledge that we can lean on when that time comes. So I think sometimes it's anticipating that and planning for that too.
yeah, absolutely.
One
Like
of-
mini groups, I feel like that helps so much to be able to like talk and be like, oh yeah, I'm not sleeping that well either. Let me tell you what I'm doing.
Something to piggyback on Holly's kind of comment. One thing that helped me, and like when I was in Google jail, I still had questions. Like there were still questions around. One of the things that, again, my pediatrician offered was a 24-hour nursing line, which I didn't even know at the time there was, because it wasn't something that was, the information wasn't there for me when it wasn't offered to me, so I didn't know it was there. But when I was talking to my pediatrician about some of my struggles, she was like, there's this nurse line that you can call anytime you have questions. And so you get to ask an actual expert instead of, one thing linking to another thing, linking to another thing. And now there's something seriously wrong with the baby.
Mm. Yeah.
Awesome. Thank you. And Jessica, you were also saying that insomnia during pregnancy is a real thing too. So even if it's not anxiety focused or fear focused, it could just be a disruption of the circadian rhythm from being pregnant when you're postpartum, if you're not able to sleep well through the night. Yeah. Thank you for sharing that.
And can I add one thing to this thread? In case there's anyone on the Facebook Live that's watching that maybe they have experienced where they've had a pregnancy where something was wrong. It's really common that if you're in a subsequent pregnancy that those fears might come up. And I think sometimes we can be afraid to almost name that. Like if you've experienced a loss, and I'll just speak for myself, in subsequent pregnancies, it's like I was almost afraid to even say that out loud. I didn't want to like jinx it. There's this kind of idea that if I speak it out loud, it's going to be more real. Maybe it will be, maybe it will actually happen. And I'll just say in that situation, talking about it actually can really help. So meeting with a therapist or with your midwife or your doctor, whoever, and just sharing the fears, even just saying it out loud sometimes can kind of unburden us from, from that fear. And anyway, I just wanted to name that because that can be useful and helpful if someone's dealing with the insomnia during pregnancy and they've experienced a loss or something challenging in a previous pregnancy.
Thank you so much, Emily. We did just have someone who joined on Zoom, so thank you for coming on live. If you have any questions for the panelists, feel free to just type that in, and we've got them on live for another few minutes here, so let's take advantage of this time we have them. Feel free to type in any question. Everything is, anything is welcome. But I did want to chat with you guys more about one of the things that came up was this idea of expectations. And there's expectations from so many different areas in our lives, people in our lives. So if someone is having self-judgment, they're having some challenges, they're comparing themselves to others, or they're hearing that voice of their mom in their head or whatever that is, what suggestions would you have for how to deal with that, or how to overcome that, or how to make peace with that? Anyone who'd like to share with the expectations and how those can drag us down?
Jennifer, can you say that one more time?
Yeah,
The
absolutely.
question.
Yeah,
Thanks.
so the expectations that we often find ourselves having of ourselves, like we should be doing this or we should be doing that, or we're not doing it good enough, those kind of things. How would you suggest that people in their postpartum time deal with those things? Is it talking to people? Is it talking to the people who are saying you should be doing it this way? How do we resolve that? Those comparisons that we make with other people, all those kinds of things.
I can speak to that a little bit. So the word expectation is actually kind of a cuss word in my practice because I hear it so often. And the way that I explain it is expectations are very strict. There's a hard line, right? They're black and white. There's no give, there's no flexibility. And we do get them from everywhere. We get them from social media, we get them from like generations, like our parents, we get them from our friends. And if we hold ourselves to those very strict lines, a lot of times they're unrealistic too, because when you're comparing yourself to social media, which we know is the highlight reel, right? When we ask our parents, God bless them, they have like amnesia, all right, about like the trenches. They romanticize what it was like when they were in it, and like, we were perfect children and we never did this and I never had any issues with this and you should try this and you should do that. And their heart is in the right place the majority of the time, but execution is so poor because they just don't remember. And I liken it to the reason we have more than one child, because you kind of forget, the difficulties of the labor afterwards. You're like, oh, it wasn't that bad. It didn't hurt that bad. Pregnancy wasn't that bad. I could totally do it again. And then you're in it and you're like, why did I do this again? So anyway, I think like we just have a little bit of amnesia when we're past the difficult parts. But when you allow those expectations to seep in, there's no give, they're not flexible. So one of the things, and I don't know if this is where the question was geared towards, but I try to get my moms and myself too, but I try to get them to change their verbiage from expectation to intention, because intention is a lot more flexible and forgiving. And there's more room for, what, I intend to get the laundry done today, but it'll be there tomorrow. And that's okay. And if, my child or my infant is having a difficult day and I can't get to it, then I don't get to it. I can prioritize and move things around. And so when those intentions aren't met, it's okay. But when you have an expectation and it's not met, then we deal with that self-deprecation and that negative self-talk. And I can't believe I didn't get to this. And it's still sitting there. And what am I going to do? But having that extra wiggle room and being a little bit kinder to ourselves, that is really the difference between feeling like a failure at the end of the day and just feeling like you did what you could. And that's enough.
Awesome. Thank
I
you.
love that. Yeah. You know, one thing that has helped me, and maybe it's because I work with moms and babies, is to put myself in the place of like, would I say that to another mom? You know, like, would you tell another mom she's like not doing a good job because she didn't do her dishes, or because her kids are like, you know, maybe not bathed as often, right? Like whatever it is that I've told myself is like not okay. Would you say that to someone else? And I'm like, oh my gosh, I would never say that to someone else. Like they're doing the best they can, like literally every moment. But putting myself in that, and then, you know, with my own therapy, you know, going through some thoughts where, you know, I see myself as a young mom and, you know, I see everything that she's going through. And I mean, all I have for her is compassion now, right? Like that's all that's there. There's not any like, wow, you didn't do it right. It's like, wow, like you did amazing. I'm so proud of you. But sometimes it's hard to get into that, you know, when you're in this mode of why aren't you doing things better? But it does help to try to think of, you know, yourself as someone else that you would want to give compassion to. Yeah.
Beautiful. Thank you for that. Awesome. Well, thank you all so much for being here. And I'm really excited because this is not the end for us with you all in fourth trimester, because each of you is a speaker at the upcoming fourth trimester Arizona conference on April 23rd. So very exciting. So just really briefly, I want to hear about what are your presentations about. I want to be making sure that I have that in my calendar and stuff. So let's see. I'm just going to double check the chat. Okay. Jessica, do you want to share just briefly about your presentation at the conference?
Sure, absolutely. So my topic is going to be how to manage mom rage. You know, that's also not in the DSM, so you're not going to find it as like a pure diagnosis, and it really doesn't need to be, because you don't have to have any underlying mental health disorders or issues or struggles to experience it. So I'm going to walk you through some of the different nuances that can lead to that feeling of overwhelm where you just kind of tip over and you either shut down or you yell or whatever that looks like. It's very individualized. And then I'll walk you through some ways to prevent or lessen that experience. So
Awesome. Thank you so much. Yeah, it's something that when I talk to my clients, they are not aware that postpartum rage is a thing. It's oftentimes the first time that they've heard that. So I'm really excited that there's going to be a focus just on that topic. So thanks for bringing that. Very exciting. Thank you.
yes, absolutely.
Holly, what are you going to be sharing with us about?
So I'm actually going to be facilitating a parent panel, and it's parents who have had babies in the NICU. So I'm certainly not the expert on how it feels to be on the parent side. So I want to be able to let the parents speak and talk a little bit about their experiences in case anyone else is having a similar journey.
Oh my gosh, that's amazing. And that's so needed. Like, as you were saying, there's higher risk of postpartum mood disorders and all those things. And having the support, being able to hear one another and share those stories, I would imagine would be very validating. So thank you for creating that. That's awesome. So beautiful. And Emily, I would love to hear, what are you going to be speaking about?
Yeah, I'm going to be talking about child loss and recurrent miscarriage, that experience and what that's like. And so I think it'll be, hopefully it will be helpful for not only parents who have experienced that, but also others who may have loved ones who have experienced that and are not quite sure how to show up for them. I think it will be I think it's important to know how to support others, and then also how to give ourselves grace and understand the grief process and not pathologize what we as humans go through. Yeah.
Oh, that's It's amazing. I love how you just described all of that because, yeah, I think loss, it actually is common. It's just something that we don't talk about very much. And when someone does talk about it, it can be difficult to know what to say, how to respond, how to actually help. And so thank you for doing that work to destigmatize this and to create this conversation around that important topic. So
Yeah. Thank you for the opportunity. I'm really looking forward to it.
thank you. And Jenny, what are you going to be speaking about at the conference?
Well, I'm going to introduce the conference and let all these other wonderful speakers talk. So I'll introduce what the fourth trimester is and then how we support families during that time. But mostly I'm facilitating all these wonderful local speakers who are part of our amazing village to really share their knowledge and their expertise. And help the people in our community just recognize that there is support, there is help, and it's all here, it's all local. We just need to be able to recognize and reach out. So that's really my goal.
Awesome. Thank you so much for creating all of this, Jenny. Like there is this theme woven into everyone's story today, which was that ultimately the resolution, the thing that made the biggest difference was reaching out and connecting with support. So thank you for creating this opportunity for all of us. I want to let you know that we get together like this. We have a different topic. It can range dramatically, but we always talk about the fourth trimester, and it's always very supportive and uplifting and encouraging. So we actually have several villages, though. Currently, they are all online. So I posted in the chat, there's a link to register for all the villages. Even though our villages are set out by region, everyone can attend all of them. We've had people come on from Hawaii, other countries even. So just know that you're all welcome to all of these. Our West Valley Village gathering is the first Wednesday, and then Central Valley Village is the second Wednesday. And those are both from 10 to 11:30. And then we have our new village, the Black Mamas Support Village, on the third Wednesdays, which is for those who identify as Black Mamas. And then we have our East Valley Village, which is this one, which is the third Thursday from 10 to 11:30. We have our Tucson Village gathering, fourth Wednesday, same time. And then we also have our ecosystem lunchtime conversations, which are mostly geared towards professionals, but it's a great way to stay connected with fourth trimester, especially if you're serving this population, to stay up to date on some really important topics and legislation, all kinds of things. Right, Jenny? What do we talk about at the lunchtime conversations?
Yeah, so we talk about the impact of different things on maternal and child health. So this last time we talked about the impact of the pandemic on relationships, and we had a judge and a family law attorney, as well as a relationship therapist, who's actually going to be talking at our conference as well, who talked about that, as well as someone who works for a domestic violence agency. So it's really much more focused on like systemic issues, which is pretty cool. And we have another village that's starting next month. Our Spanish speaking village is going to be on the first Wednesday. So it doesn't matter where you are every week, pretty much you got something to join in and share and get resources.
Thank you, Jenny. And how can people register for the conference?
Yes, so if they go to our website, there's a big picture on the top. You just click on the picture and it takes you right there. And it is free for people who have WICCAN access. And if you have a need-based financial need and you can't register otherwise, let us know. We want to make sure it's available to everyone.
Thank you. And is it $25?
$25, yeah.
For an entire day of these amazing conversations.
17. No, I think we actually have more than 17 speakers. But yes, it's going to be amazing.
So number 4, trimesteraz.org is the website to go on to get your tickets. It's going to be incredible. And this is the 4th year?
5th year.
5th year. 5th year. Okay, so go get your tickets, everyone, and then come back here to meet with me in a month from now. And we're going to be talking about like gathering resources, actually. So funny, that was a major theme for today. So our next East Valley Village, we're going to be using it as kind of like a mastermind. for people to come together to share what's actually working for them, and make recommendations and be able to really come together with the real life stuff of what's helping. So definitely fulfilling on the vision for what we all shared today that we need. So thank you all so much. We're gonna pop off into our private Zoom now. So everyone have a wonderful day, and thank you so much for being here.